Well, so on the surface, that seems like a really easy question. You should be able to go to the phone book, pick a name, and have a good doctor, but it's not always that easy. Personally, I've been through the experience 3 times. I have 3 kids. First one was before medical school, and I didn't know what I was doing, so I wish that I had the information I had now to go forward with. So it's actually not a complex process. First, go to your friends, go to your family, whoever you know in the medical field, and get some recommendations, names that they like, they trust, people that they feel are good doctors. See what their interactions were in the office, how they respond to the kids, if they're laid back, relaxed, do they take time to answer all your questions, do they rush through appointments. You may find that people like the name they give you or don't like the name they give you, but that may narrow you down to a few names. It may keep you at 10 or 12 names. But that'll at least get you started. Then cut the people you have to cut if they're not covered on your insurance plan, if they work too far away, if you didn't want a female, if you didn't want a male, then cut those people out. But keep a semi-open mind. Once you have your list, it may be 2 names, it may be 5 names, then go ahead and call the offices, schedule a meet and greet. And we do those in my office. We do them usually at the end of the day so we can spend as much time with each family as we need to, answering all their questions. Usually there's no charge for that, and they'll take as much time as they need. Ask the important questions to you. You can go online, get lists of 10, 12 questions, but I think the most important thing is your comfort. When you go in, when you ask a question, is the answer quick, easy? Is it a comfortable situation? Do you get along with the person? Do you just feel like you're in the right place? Obviously, if you have quirks, things that are very important to you, breastfeeding, immunizations are a very, very popular topic, alternative medicines, things that just are very important to you. Ask in detail about those questions to make sure that you feel like your views and the pediatrician's views jibe there. Once you've gone through that experience, I think usually it's pretty easy to feel comfortable in one office versus another. So once you've done that, really, I think your process is complete. You go home, talk to your partner, make your decision, and let the hospital know when you go in to have the baby that you know who your pediatrician is. They'll call them up, and you're on your way. And remember, no decision's permanent, so hopefully things work out great. If they don't, then you can always go through the process again and have somebody different. The relationship that you develop with a patient over that first year and even thereafter is really important. In my current job, I've been for 4.5 years, and the relationships I've developed have allowed me to not necessarily feel like I'm friends with all the patients, but to be very comfortable with them either in or outside of the office, should I see them out. And just to be able to have that comfort level with the families is extremely important, because the kids feel more at ease. They'll act themselves around you. You can then tell, are they sick, are they not sick, just by the way that they're acting in the room with you, because that interaction does develop over time. And if you don't know someone, if you don't see them frequently, if you don't feel comfortable with them, then you don't get any of that added help with you from a diagnostic perspective. So I think it's very important to have that personal relationship with the families to move forward in that. What's most rewarding, I feel like I'm supposed to say, oh, the lifelong health of the kids. But honestly, I think one of the most rewarding things is just having that relationship with the kids. And when they come in and the parents tell me that they've been talking about coming in for 2 or 3 days, and they played doctor all morning and were pretending to be me, and things like that are really, really important. They may come into the office and they may not show that. They may bury their head into their parents' chest and not talk to me, not interact with me if they're 2 or 3 years old. But just knowing that I've made that difference in their life, and they're able to kind of look at me not as this scary figure, but as somebody that's there to help and interact and just kind of be friends with, almost in addition to take care of. That's important to me. So developing that relationship is huge, and that makes me feel like I'm actually making a difference long term in those kids' lives.